WEMIHS was established in 1998 by dedicated women who committed their minimal resources to addressing HIV/AIDS at the very early time when there were no interventions at the community level and when there were no structured national response. And therefore, one of the things that came out for us is we realized early enough women vulnerability as we were identifying the relationship between HIV/AIDS and its impact at community level. And one of the things that emerged very, very clearly was the vulnerability of women, its relationship to HIV/AIDS, and the fact that most of the women affected by HIV were also experiencing gender-based violence. With this kind of a background, actually, we had a goodwill of ordinary poor women in our communities playing extraordinary role in helping to respond to the HIV/AIDS menace, particularly with limited resources. And they brought out clearly the very unique needs of women, girls, and their vulnerability. Continuing from that early background, WEMIHS as an organization has continued to be committed to responding to the unique needs of women, girls, and in particular with an interest to ensure that our programs are informed by the realities and the desired change that will increase accessibility to equal services, opportunities, and their engagement in activities that promote their well-being. Moving forward with this kind of focus, we have had programs and have focused, or rather we have focused on program areas that are very relevant to the gender-based violence and gender justices. For example, one of the most recent program areas we focus on is sustainable livelihood. This particular program allowed us to identify the most vulnerable, which 85% of the most vulnerable households were women, and engage them into identifying their desired change. And most of it were actually indicators that improve their well-being, their economic well-being, their food security, and their engagement in leadership and decision making. We have also had an opportunity to work on child protection because we identified when you improve the well-being of women, children are the greatest beneficiary of the outcomes, and hence we have been able to identify the need for child protection and have engaged with women, enabling them as key actors in the well-being of children, as well as working to strengthen the support system at community level that provide women and children safety. That includes strengthening community safe spaces, strengthening community as agents of change through safeguarding of children, and strengthening the skills and voices of women so that they can be actually advocates of change. I must appreciate that WEMIHS work is not done in isolation. It has involved strategic partnership and collaboration with other key stakeholders, and this has actually provided WEMIHS an opportunity to play a coordinative role among the collaborators, and this has involved identifying key actors with influence into bringing around the desired change. We have worked, for instance, to strengthen the community systems right from the community level. We have worked with key actors at the local government level who influence implementation of policies around child protection and gender-based violence. And we have brought around the corporate sector to appreciate and support through their resources. At large, I must say that all the collaborators are currently working well in response to our collective support for gender-based violence and child protection. In this request, WEMIHS has two main objectives. One of it is to improve WEMIHS organization resilience with technical capacity. That is the capacity which will support her as a local organization to effectively facilitate others in the prevention of gender-based violence and also to facilitate access to justice. That is for women, girls, and children. The second objective for this request is to increase WEMIHS' ability so as to create innovative resource mobilization strategies to support sustainable feminist interventions over the long term. WEMIHS focus three main most vulnerable groups, and these are women and girls in communities practicing harmful cultural practices and populations that experience injustices, such as, say, for example, gender-based violence, female genital mutilation, and early marriages. We have also identified vulnerable households most affected by poverty, and particularly in marginalized areas where women are struggling to put food on the table with extremely limited opportunities of income or skills. Now, children and youth living in high-risk areas, say for example, the slum dwelling and marginalized communities, have continuously emerged to be a critical focus benefiting from WEMIHS programs. The primary focus beneficiary of WEMIHS work are actually three categories of beneficiaries that have continuously emerged as most vulnerable and impacted. Say, for example, we greatly focus on women and girls in marginalized communities, and these are communities often practicing harmful cultural practices that result into gender-based violence, early marriages, or FGM. Then, of course, in these communities, we also have identified that there is a large-scale marginalization for women in general to access services, opportunities, or support to experience their full potential. The other category are vulnerable households themselves in marginalized communities who are struggling to cope with the impact of poverty and disasters and diseases. Our third category are actually children and youth in most vulnerable households, and in particular, we are more concerned about children living in high-risk setting like the slum dwelling and in marginalized communities, and they have included even street children. WEMIHS work is guided by the mission improving quality of life of individuals and households by building their capacity in partnership with other actors, identify and address their health and development needs. Hence, our work as an organization contributes towards realizing a world where support systems work in a coordinated way to facilitate vulnerable children, women, and girls grow in safety and develop their full potentials with equal access to opportunities, services, and even protection, which could be provided or are provided by a range of stakeholders. For example, in this, we see opportunities where stakeholders or different stakeholders provide a range or could provide a range of services, both the support services, social support services, and even opportunities and privileges to women and girls. We also see stakeholders, which are government, local or authorities, who require to implement sustainable interventions, policy-led interventions. WEMIHS has had a privilege to implement program work that has actually given significant impact, as indicated in various evaluation documents and also evidence in the life of the beneficiaries. And some of these experiences are what we would want to build on, and particularly so that we can realize long-lasting results. I will mention a few of the most significant results that we have had. For example, on the top of it, our mobilization has led to increased stakeholders' response, so that different stakeholders are more aware and responsive to gender-based violence and child abuse. They have been engaged in the safeguarding interventions and have become collaborators working on collaborative actions, which we agree that we can work in a harmonious collaborative response. Some of these is advocacy to influence policy. Now, we have also seen increased percentage of vulnerable female-headed households in marginalized areas, particularly in the semi-arid areas, becoming food secure, being able to adapt good farming practices, and increasing their accessibility to food, nutrition for a longer period. We have also evidenced increased percentage of income in poor-headed households, which are female-headed households. For example, because women have been able to engage in productive work and to engage in income-generating activities that bring an income, and women are being able to make decisions of how to use these incomes in their lives. Now, one of the other quite exciting thing is that we have seen increase in the engagement of community-based organization who we enroll as our agents of change, effectively being able to mobilize and catalyze their own communities to achieve desired change. And this, for example, has been working with the skills that we have shared with them to engage communities in dialogue about the root cause of gender-based violence and abuse of children, and even agreeing on strategies on how to reduce that. That has been exciting for WEMIHS. Now, currently, we are having an experience where we have seen improved stakeholders working on a collaborative action. And this has been useful because it has expanded the networks of organization forming a consortium that brings together collective voice for greater, maybe, and more sustainable intervention. And through this, we have seen an establishment of the Children's Court. We have seen even an establishment of a child protection unit at the police stations. And now currently we are seeing the strengthening of the same consortium to expand on policy issues around gender-based violence and providing safe spaces for women and children. WEMIHS program and activities are fully informed by real experiences and our very deep concern for the need to respond to the unique needs affecting the most vulnerable. And the most vulnerable have often and almost always emerged to be women and girls who are highly exposed to abuse and are living in marginalized environment where they also don't access justice in a timely manner. And I think that is where it brings our connectivity with working on feminist programs. Now, because of that, our activities are designed and are delivered with great consideration for key feminist focus activities that has involved some of the following. For example, in the design of the program, we deliberate to use approaches that are gender responsive and where women are fully engaged in identifying their own needs and the desired results and bringing out their unique circumstances. Those are over 80% of our beneficiaries, and therefore we capture the needs of women and their unique circumstances with their voices. And the other thing is that WEMIHS activities allow for space for women and girls to access skills, services, and even to be linked with collaborators' services, to include even services that are provided at government level or are policy driven. The other level, besides working with individual beneficiary, is that we work towards strengthening community systems so that they are inclusive and that they provide safe spaces that allow women and girls to express, to engage, and to benefit through greater access and availability of services. All our trainings, information, and communication are actually gender informed, and that means working at the grassroots and strengthening and creating awareness about unique issues related to women and their need for greater opportunities in safe spaces has helped make a difference. We have talked about feminism from 3 levels or 4 levels. A, we have talked about that we identify unique needs of women by allowing them to actually, in a participatory way, express their needs and their desired outcomes. On a second level, taking those needs, we come and design programs that are gender responsive, and hence using approaches that are sensitive to the needs of women, in far as allowing them greater access to, engagement in productive activity, and resulting into greater and safe platforms for their decision making, planning, and influencing desired change. And beside the individuals, beneficiaries, we aim at strengthening community systems so that the systems can allow for safe spaces at the community level, inclusivity, and be sustainable environment for change. Yeah, I think we can also say that our trainings on female-led community group or female-led community groups to become agents of change has greatly increased the capacity of grassroots partners to achieve what women really are talking about as their own unique issues. The communities, through the dialogue and these spaces, now appreciate that the women unique issues are real, and they appreciate that they too can contribute to making a change. For example, a key issue is addressing the cultural and social harmful behaviors, deliberating on them as root causes of abuse